Right now, we have a strong association between Zika and microcephaly, particularly as it's been reported out of Brazil and Latin America. But what has to happen is we need prospective studies whereby we follow women through their entire pregnancy and monitor them not only serologically, but also virologically for evidence of infection, and then correlate it with outcome in the newborn child. That will be the only way that we can unequivocally prove that Zika is the cause of microcephaly in those babies.
We know that there are other viruses that can cause malformations if the pregnant woman acquires the infection while they're pregnant, especially in the first trimester.
You have to remember that microcephaly is caused by various different causes, some of them infectious, some of them not. For example, cytomegalovirus, HIV, rubella, all can cause microcephaly, as can fetal alcohol syndrome and other nutritional problems.
The way to actually prove it is to do a very careful case control study, which is where you take babies who have microcephaly and their mothers and study them to see if they were infected with Zika. And then you take babies who weren't affected by microcephaly and their mothers to see if they were affected by Zika. But you also look for all sorts of other things, such as evidence of malnutrition, vitamin deficiencies, other congenital exposures to toxin or known agents that can cause congenital malformations.
Once you do that, we'll have a better idea. It's going to be very challenging even to diagnose Zika virus because we don't have very good diagnostic tests, because there is a lot of cross-reaction with antibody tests. PCR positivity is only very transient because this is a very self-limited disease.
Once that information is available, like it has happened with other viruses like herpes virus or CMV or infections like toxoplasmosis, then we will know exactly that, or we will prove that that was the cause for that malformation, and we know exactly what it does.
Do I think that the response is over the top based on the fact that we don't have a causal link? No, because there is a high association, and there is a lot of public worry and public panic, which I believe is enough to justify the CDC's recommendation that pregnant women not travel to areas in which Zika is spreading, and the International Olympic Committee's decision to ask pregnant women not to come to the area where the Olympics is going to be.
I think the response now is becoming more measured as the association between Zika and microcephaly matures. Definitely, a lot of work needs to be done on developing a vaccine. I would like to say that we could develop an antiviral drug to cure Zika, but as you're aware, Zika, drugs, pregnancy are a problem because we just don't willy-nilly throw around drugs to pregnant women.
In the United States, we do have a competent vector to transmit Zika virus. The one is Aedes aegypti, which is the one transmitting it in South and Central America, and that is mostly in the Gulf states, in Florida and Louisiana. But we also have Aedes albopictus, which is a mosquito that's prevalent through a lot of the southeast, and during the summertime actually can be found as far as north as Pennsylvania. That mosquito may not be quite as much of a problem in transmitting it, but certainly can. And so besides trying to protect our travelers and people who are going to Zika endemic areas, public health would really like not to have Zika established in mosquito populations in the United States, particularly in Florida and Louisiana or Hawaii.